Hello, Assalamu alaikum students, how are you? In today's video, my topic is femoral nerve. As you all know that femoral nerve is a main nerve supply of the anterior compartment of thigh. So first of all, femoral nerve, how femoral nerve is formed. So here you can see here we have got lumbar plexus. As we know that lumbar plexus is formed by the contribution of T12, which is subcostal nerve, then L1, L2, L3, L4, ventral rami of all these nerves. They contribute to result in a formation of a lumbar plexus. And from this lumbar plexus, from L2, L3, and L4 contribution results in the formation of femoral nerve. Here femoral nerve is being formed. So here if you look carefully, this femoral nerve, it has got root value of L2, L3 and L4. So L2, L3 and L4, their ventral rami, they contribute in a formation of femoral nerve. So femoral nerve is produced within the psoas muscle. Then it passes posterolaterally between the psoas muscle and iliacus muscle. And here you can see this nerve is supplying the iliacus muscle here in the background, the bigger one, fan shape, and then here psoas muscle. So both are being supplied by the femoral nerve, both muscles. Then along the lateral margin of the psoas muscle, this nerve moves downward and behind the inguinal ligament, almost just lateral to the mid of the inguinal ligament, just lateral and mid and posterior to the inguinal ligament. Here this nerve passes and then it enters the femoral triangle. Here femoral triangle. So femoral triangle spans between the anterior superior iliac spine and pubic tubercle, and just lateral to the mid of the femoral inguinal ligament, we have got femoral nerve, and femoral nerve is actually present outside the femoral sheath, outside the femoral sheath. So once in the femoral triangle, this nerve divides into multiple small branches. As you can see, multiple small branches, and most of them they supply the muscles. For example, here you can see sartorius is being supplied. It is muscle of the anterior compartment. Then rectus femoris is being supplied, which is also muscle of anterior compartment. So anterior compartment muscles of all the muscles of anterior compartment, they are being supplied by, they will be supplied by the femoral nerve. Then vastus lateralis, vastus intermedius, and vastus medialis. These are all supplied by the femoral nerve. Now, there are two other branches here you can see. These are actually cutaneous branches of femoral nerve, anterior cutaneous nerve. Here you see anterior cutaneous nerve. These two branches, they supply the anterior and upper medial part of the thigh skin. So it would be supplied by anterior and medial, upper medial part of the thigh would be supplied by the anterior cutaneous branches of the femoral nerve, except for an oval area which would be supplied by obturator nerve. Beside that, you can see there is another very interesting branch which is called Stiffness nerve. This Stiffness nerve, along with the femoral artery and femoral vein, enters the adductor hiatus or subsartorial canal, and here you can see it passes between the sartorius and gracilis, and it has another branch which is called infrapatellar branch. Here you can see infrapatellar branch. This Stiffness nerve is also a branch of femoral nerve. Then it moves downward medially along the leg along the side of the leg. Then it passes in front of the medial malleolus, just parallel to the saphenous vein, great saphenous vein. So while performing venous cut down or saphenous cut down, there is a chance you may damage this saphenous nerve. This is the nerve which gets damaged, saphenous nerve, and then supplies the medial side of the border of the foot. So this is all cutaneous innervation, as you can see. So this all blue area, this is would be supplied by the saphenous nerve, which is a branch of femoral nerve. So again, this anterior cutaneous nerve, these are also branches of the femoral nerve. So this was the femoral nerve. So once again, quick review: L2, L3, L4, ventral rami of the lumbar plexus. Then it passes between the produced this nerve produced within the muscle psoas major, then along the lateral as between the this in the background iliacus and psoas, then passes behind the inguinal ligament and reaches the femoral triangle and divides into multiple branches and supplies all the muscles of the anterior compartment of thigh. And there is another articular branch as well, which I forgot to mention here. Articular branch. This articular branch is going to supply the hip joint. Is going to supply the hip joint. So this is Hilton's law here. Hilton's law states that any muscle crossing certain joint, the nerve supply of that muscle would also supply the joint as well. So here you can see this is Hilton's law being applied here, because iliopsoas, these both are supplied by the femoral, so they cross the hip joint, so that's why their nerve supply also supplies the, yeah, look at the hip joint. And then stiffness nerve supplies along the leg and foot, and anterior cutaneous branches which were supplied by this blue area. These are also branches of anterior cutaneous nerve, branches of femoral nerve. So this infrapatellar branch also supplies the knee joint as well. So this was about the femoral nerve. I hope it will help you. Thank you very much.